we have to make sure the patient is physically able to undergo the procedure. We deal with reconstruction. We try to make things, the form and the function of the unit that's injured, we try to restore it to its original use. But the patient, if he's been severely injured in a car accident, has say, a intracranial injury, or a ruptured spleen, or life-threatening injuries, those injuries have to be taken care of first before we go on to reconstruction. So that may delay the treatment a little bit. We're trained to do a variety of wound closures. We may just simply close the wound with sutures. We may have to do skin grafts. We may have to borrow tissue locally and bring it into the area, like borrowing from Peter to pay Paul, using a local skin or a muscle flap or something like that. So there's all kinds of different wound closures. It kind of depends on what's required on the wound. Do you just need skin coverage? Do you need muscle? Do you need fat? Do you need other body parts? So every wound is different. One of the things I tell people is that it's hard for me to keep all the codes straight for all the different procedures we do, because in plastic surgery, I think I counted up over 1,800 different procedures. Whereas when you're like a general surgeon, you do a lot of gallbladders, and you do a lot of appendectomies, and you do a lot of colon resections, and you do this and that. But there's 20, 30 procedures that you do mostly all the time. With plastic surgery, it's different every day. You may do something, I may operate on an infant one day and then operate on a 100-year-old the next day, or the same day. And I may operate on somebody's head and the next day I'm operating on somebody's foot. So plastic surgery is interesting in that it encompasses the entire body, and it's cradle to grave, basically.